Good day everyone, I'm CP Rehan Monte. In this video, I'm going to assess mouth and oropharynx.
Inspect the outer and inner surface of the lips, noting symmetry of contour, color, texture, and lesions. Ask the client to purse his lips. This variation in color and texture may indicate poor nutrition, dehydration, or hypoxia. Lesions may indicate skin infection. Inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and any presence of lesions. Careful inspection may reveal nodules, lesions, and first signs of mumps and measles. Ask client to open his mouth. This is to assess the oral cavity. Remove dentures if any. If able, you may ask the patient to her or himself inspect condition and fit. To inspect the gums clearly. Inspect the teeth and gums for discoloration, diseased, or missing teeth. This is to determine any swelling in the gums. Inspect the roof of the mouth for color and structure. This reveals any deformities in the hard or soft palate or pallor. Inspect all surfaces of the tongue and the floor of the mouth. This is to reveal any deformities, lesions, color, texture, size of the tongue. Ask the client to protrude his tongue. Inspect the upper surface for color, texture, and position. This is to reveal signs of vitamin and mineral deficiency. Beefy red tongue indicates vitamin B12 deficiency. Have the client place the tip of his tongue on the roof of his mouth. Use a pen light to inspect underside of the tongue, frenulum, floor of the mouth, and submaxillary glands. This reveals surface presence of veins and saliva. To visualize any oral maladies that develop in the area of under the tongue. Ask the client to roll his tongue upward, downward, and from side to side to check tongue movement. This is to check the tongue movement. Wear gloves and palpate the tongue and the floor of the mouth. This is to determine the abnormalities in the tongue. With the use of a piece of gauze, pull the tongue to the left and examine it. Then do the same on the other side. This reveals the lesions or patches and the sides of the tongue where malignancies are common. Ask the client to tilt his head back and open mouth as wide as possible. This is to have the clear view of the mouth. Use tongue depressor and shine a pen light into oropharynx. This is to detect the inflammation and infection. Inspect the hard and soft palate and tonsils. Note the color, shape, texture, and condition. This is to check if there is any infection on the palate. To inspect the ovula, ask the client to say "ah" and watch the ovula as the soft palate rises. Inspect its position and mobility. Try deviation to the side or absence of the movement indicative nerve damage. Inspect tonsils for color, ulcerations, exudate, and enlargement. Tonsils that are swollen, bright red, or have exudate may have infection. Test the gag reflex by touching the back of the soft palate with a tongue depressor. This is to check the gag reflex.
So that's it in this video. Thank you for watching.